is not a normal pain, it is deadly pain. No one can describe that pain. So that is going to be the quality of pain. Okay. So the pain mostly would be retrosternal, behind your sternal bone, and it would be radiating to the shoulder or sometimes to the jaw, and the pain is going to be very severe. Okay, that is nothing but in simple terms that is heart attack pain. Okay. Now what are the other symptoms if the patient is going to have a high blood pressure? Number one, patient will be aware of his own heartbeat. That is nothing but palpitations. Gunde dada, that is what we say, right? So if the person is aware of his own heartbeat, he will be telling that my heart is racing. I am able to sense my own heartbeat. So normally when we are like this, I am not able to perceive my own heartbeat because I am not aware of it. But if your heart is making you believe that it is working in a way that you are able to sense its own numbers, right? Then that is palpitation. So when you have palpitation, right, when you have some sort of retrosternal pain, so these might be the symptoms of long-standing hypertension. And now why did I say that time is muscle? Because the damage caused by the flow of the blood to the heart damages the heart muscle in such a way that once the part of the muscle is damaged, it is gone forever. Right? Now you start believing the importance of controlling hypertension, because once a particular part, say some few millimeters of the heart muscle, if it goes off, now we cannot replenish that muscle. It is not like liver. We cannot regenerate heart muscle. Okay, that is the reason why time is muscle. That is the reason why if a patient presents with heart attack, myocardial infarction, within the first 6 hours we need to take him to angioplasty, preferably in the first 3 hours, or else the part which is going to decay will not regenerate. So the entire heart is going to beat in one way, in one rhythm, and the part which got decayed, which got rotten by the lack of blood supply, will be beating in a different fashion. So obviously there will be formation of clots, right? Just start believing, like once if you expose your injury to air, what happens? It is going to clot in some time, right? So heart beats in such a way that blood remains in a fluid state. It has to go forward. So if that speed is compromised, if one part is beating at one pace and if the other part of the heart is beating at some other pace, then obviously the blood is going to stay more time in that part, right? So clots are bound to happen. Okay. Now what happens? Eventually heart is going to pump all this blood forward, right? What is the function of the heart? The function of the heart is to pump blood to the remaining parts of the body. So if the heart is going to pump the blood containing clots, now you imagine if that clot goes and sits in the brain, patient will get stroke. Stroke is nothing but, brain is like a switchboard. Okay, there will be a particular switch controlling a particular part.